Hey everyone, I'm back with another video. I just wanted to talk to you about the chemo treatment my mom had. Like I said, she had acute myeloid leukemia, and the drug they used for her chemo was Decitabine, which is a chemotherapy medication that reduces the growth of cancer cells. It treats myelodysplastic syndromes. My grandfather passed away of myelodysplastic syndrome in 2001. It also treats things like acute myeloid leukemia. It happens when your blood stem cells don't become healthy blood cells. And what is this medicine? Basically, it's a chemotherapy drug. It reduces the growth of cancer cells. It is used to treat adults with acute myeloid leukemia or myelodysplastic syndrome. And then my mom, in the beginning, she had chemo every 28 days. This was in October of 2019 all the way until January of 2020. That's when they realized she had another bone marrow biopsy in January of 2020. Her cancer was completely gone. There was no sign she ever had cancer. She was in remission within 2.5 months of being diagnosed. But like I said, acute myeloid leukemia is terminal. Though she was in remission, she still had to go through chemo every 3 months. That was, the doctor wanted her to go through chemo every 3 months. And then she had another bone marrow biopsy in September of 2021. That's when it showed that her cancer came back, and they told us when the cancer comes back, it will come back with a vengeance. Wanted to talk to you. And then September of 2021, she ended up, she had chemo still when it came back every 28 days. And then she would have to have platelets and blood transfusions every so often. Platelets are tiny cells in your blood that help stop bleeding and form blood clots. They are created in the bone marrow, and there's large cells in the bone marrow. When a blood vessel is damaged, platelets travel to the area and clump together to form a clot. She would have platelets every so often, every couple weeks, but mainly I want to say in the beginning, September 2021, she had blood transfusions every month. A blood transfusion is a medical procedure that involves giving a patient healthy blood or blood components through an IV. Transfusion replace lost blood components or provide blood when the body isn't producing enough. They can be used to treat a variety of medical conditions, including anemia, active bleeding, and symptoms related to anemia. She would, and towards the end, every other week, she'd get a blood transfusion and platelets. But then when she went into the hospital in May of 2023, she was in there, I want to say 12 days, and she had like 10 blood transfusions. So just kind of showing how she went. And the chemo never ever made her sick. Never lost her hair. She never lost weight or anything. It made her extremely hungry. She loved Popeyes. So she'd go to Popeyes, which was right next door to where chemo was, and I believe there was Taco Bell. She also loved to bring her putter. She loved golf, so she would unplug her pole because it ran on batteries, and she'd go outside and practice putting while she was getting chemo. The only thing that really, really made her nauseous and very sick is when she got blood transfusions. She would have horrible headaches and always very, very nauseous. But just thought I'd share with what my mom went through.